Hello again, this is Dr. Tony Madril with another 3 minutes for your mental health. In this video, I'm going to be answering the questions, what is the difference between top-down and bottom-up techniques in trauma therapy, and how should these two types of techniques be used to have the most therapeutic effect? Top-down and bottom-up techniques refer to working with trauma symptoms by engaging different parts of the brain to have a restorative effect upon the limbic system, sometimes called the emotional part of the brain, when a person is triggered by a reminder of past trauma. Whereas using techniques that engage the cortex, sometimes called the thinking part of the brain, to have a calming or restorative effect upon the limbic system may be considered a top-down intervention. Engaging the brainstem and the body to have a similar calming effect upon the limbic system can be characterized as a bottom-up technique. As noted, each set of tools can have a restorative effect upon the limbic system when someone is feeling emotionally triggered and may be best applied at different times during a troubling episode of traumatic stress. For instance, when a client is experiencing overwhelming emotion, I typically recommend that they first use a bottom-up technique to calm the limbic system, because the fight, flight, or freeze response generated by the limbic system may be temporarily subduing the capabilities of the thinking part of the brain to aid them in this emotional crisis. As such, using a top-down intervention in those moments may be less effective. Some examples of bottom-up techniques that I recommend that clients use in such a situation are mindful walking, yogic breathing, and activation of specific acupressure points. After the person has experienced a noticeable relief from emotion using the bottom-up techniques, I then proceed to recommend that they apply top-down interventions like cognitive restructuring to engage the prefrontal cortex, which should be more accessible to them as the nervous system begins to settle. Cognitive restructuring can further calm the limbic system and help to return them to a normal state of functioning. Some cognitive restructuring techniques that I recommend to my clients are labeling emotions, noting distorted beliefs, and developing new ways of thinking about feared situations. If you would like to learn more about best practices for treating trauma, I invite you to subscribe to my YouTube channel or visit my website. Thank you.